So, Dr. Petrosino, I do want to start with testing. Testing for COVID-19 set to get a lot easier over the next few months, but this is overall testing not really getting the best reviews that we've seen, people not having a lot of faith in the testing that we've done so far.
Yes, no, it's definitely a concern, and it's something that we've been fighting against since the beginning of the pandemic. And I think with recent advances in at-home testing in particular, I think we're starting to see game-changing opportunities to be able to take testing to a new level and have people have the confidence that the results that they're getting are correct and can be used to help them make decisions and help companies make and businesses make decisions as to reopen and how to reopen.
And we heard Friday from White House senior advisor Andy Slavitt saying that these at-home COVID tests over the counter, so you perform it yourself, and he was saying some of them can detect COVID roughly 95% accuracy within 15 minutes. So this is different than what we've been seeing right now in the market.
Exactly, and I think especially the Illum test that's coming out of Australia that is now receiving money from our government to be able to boost production and actually have production in the United States. It's tests like these that are going to be the game changers. These are rapid antigen tests that are, as you mentioned, not needing a prescription, so no need to go into the store and potentially interact with people and potentially spread the virus even more. You can pick them up or have them and not have to interact with a doctor or pharmacist. Pick them up, take the test at home. There's a interaction with your phone such that the results are reported to your public health officials as well as your doctor. And that chain of information distribution is also very critical so that the government can know where to move and local health officials can know where to move resources so that we can continue fighting the disease.
So do you think this will be able to bring people back to work or kids back to sports or gathering again?
I think it's part of the equation, and because again, one of the cost point for this test right now is set to be around $30 per assay. And of course, when you take the test, it's taking your measurement of whether or not you have the virus at that point in time. As soon as a day later, that could change. And so what we're really looking at is a sort of a platform of testing so that people can take these tests, have affirmation that they don't have the virus, but also have access also to even less expensive tests that have good accuracy so that we can be monitoring over time, especially congregate settings like nursing homes and workplaces, and do that in a cost-effective manner. So again, you have that sort of a full armor of testing to say that, hey, I'm not positive today.
Now, what about that nasopharyngeal swab? That seems to be like the gold standard. How do you compare these two?
No, you described it accurately. It really is the gold standard, and it's the target that other tests are trying to live up to, but in a way that's cost effective and also quick. And so the newest tests, for example, this Illum test that was announced out of Australia, reaches approximately the same level of efficacy as the nasopharyngeal swab. In fact, it is a mid-turbinate swab that one is to administer at home. So it doesn't go all the way back. You're not giving yourself a minor lobotomy, it doesn't feel like, but it still reaches halfway into your nasal canal, and then you swab, and there's a guide to help you judge how far back you're going. And then once the test is, the swab is removed, you mix it with a buffer and then look for a readout in 15 minutes. And there are controls built into the test to make sure that the person at home is administering the test effectively. So I think the newer tests are becoming more foolproof in terms of being able to have an individual administer it without the help of a healthcare provider. So I think that's also part of the game-changing environment.
And do we know if these tests will be able to detect the variants that are out there?
That's a great question. So I know that many of the testing agencies, so Abbott and Illum and others, are testing their products. These companies are testing their products routinely with new variants that emerge. Fortunately, the reagents that go into making these tests are what we call broad spectrum. And even as we look at the picture of the virus itself, you could point to the fact that the red spikes versus the white sort of background, The Illum test, for example, is looking at the background white component of the sphere, and that's more consistent across the variants and the isolates of the virus that are emerging now. So having targets that are a little bit more or a little bit less variable, so to speak, actually makes these tests more efficacious over longer periods of time.